Uphill battle for Black mothers in our city when it comes to giving birth. The numbers providing a glimpse at our nation's lapse in maternal health. I pull the curtain back on America's secret shame and share how I'm personally connected to the issue. Having a baby can be one of the most exciting times in a woman's life, but for many Black mothers, the miracle of childbirth is tainted by a morbid reality.
So Black women in America have 4 times the likelihood of dying during childbirth and right after. In New York City, it's 12 times the amount.
A hard pill to swallow. I didn't truly believe it until I had my own experience.
Say hello to everybody.
Last September, I gave birth to my baby girl, Ava. But once she turned a week old, I was diagnosed with postpartum preeclampsia, a condition caused by high blood pressure and protein in the urine after giving birth. However, this was discovered after an urgent care doctor tested me for this condition, going against my primary doctor's orders to go home and rest. Instead, I was sent to the ICU where I was monitored for nearly 3 days. If I had listened to my doctor, my condition would not have been found and the preeclampsia could have led to seizures or even worse, death.
I said it's one thing to hear a statistic. As you go further and further through it, it does start to become a little bit more real.
Unfortunately, my story isn't much different from other Black mothers in our city. Numbers from the New York City Department of Health show there are 126.7 deaths per 10,000 live births for white women, but a staggering 386.9 deaths for Black women. And the highest maternal death rates are in Brooklyn and neighborhoods like Brownsville and East New York, followed by the South Bronx, where mostly Black women deliver.
And we see that some of the causes of this huge disparity is due to institutionalized racism and discrimination that affect all women of color, but especially Black women.
Poor postpartum care reaching Black celebrities like tennis champ Serena Williams, who after having her daughter last summer says she had to repeatedly ask for the correct course of treatment despite a known history of blood clots. And the family of acclaimed TV judge Glenda Hatchett, whose daughter-in-law died from blood loss in 2016 after a routine C-section, even after her husband repeatedly told staff his wife wasn't feeling well.
White women, their outcomes improve up the socioeconomic ladder. Black women don't have that improvement.
So what can Black mothers do? Doctors say advocate for your health.
If there's something that seems like it's not right, seems that it's off, or just anything that seems concerning to a patient, whether they're being treated in the emergency department or on an L&D ward, they should speak up for themselves.
So there are many different ways that you can advocate for yourself if you have to. One way that I did that for myself was by using my blood pressure machine and taking my blood pressure every single day. And then I gave those numbers to my doctor so that she knew what was really going on. But Yael says Black mothers need more support at the beginning, which she says St. Barnabas is implementing.
And so we're going to implement a doula program, as well as looking at, how everything functions, from our clinic to, how we address women coming into triage and labor and delivery.
Also, my husband and I urge doctors just to listen to their patients.
The biggest thing is that they always say the patient is going to tell you what's wrong with them. All you have to do is listen.
Thankful that I had one doctor who listened, giving me the opportunity to enjoy the gift of motherhood.